Hello and welcome to our Flash Note series. In this series of lectures, we will discuss briefly on very high yield clinical conditions with their clinical correlations. This is Flash Note 3. In this particular Flash Note, we will discuss about the adult derivatives of neural crest cells. This particular Flash Note is very high yield, so please go through it thoroughly. Before understanding the proper concept of neural crest cells, I will suggest you to go through the neural tube, where I have talked about the process of formation of neural crest cells. So, in a brief note, neural crest cells are derived from ectodermal cells, and ectodermal cells at the edges of neural fold is induced by neural tube to form neuroepithelial cells. These neural crest cells thus formed then migrate and give rise to multiple adult derivatives. So there are cranial neural crest cells, there are vagal neural crest cells, there are trunk neural crest cells and sacral neural crest cells. So memorizing neural crest cells is always a very tough job. So here I come with mnemonics for the adult derivatives of neural crest cells. So mnemonics is like motile pass. The M for motile pass indicates melanocyte cells, O for odontoblast cells, T for tracheal cartilages, E for enterochromaffin cells. The cells for Orovach plexus and Meissner plexus, and leptomeninges, which is a combined word for arachnoid matter and pia matter. The cells like PNS ganglia, ganglia on the cranial dorsal root, and autonomic ganglia like adrenal medulla chromaffin cells, Schwann cells, and spiral membrane, that is aorticopulmonary septum and heart, endocardial cushion, and skull bones. These are from the pharyngeal arches. So one high note is that parafollicular cells, or the C cells, were previously thought to be neural crest cells origin, but now they are considered to be endodermal in origin. That's why parafollicular cells, or the C cells, recently it has been suggested to be endodermal in origin. So let's test your understanding on neural crest cells. Here, a patient presents to a clinic with pale blonde hair and blue eyes. He notes that he sunburns easily. Very high information. He sunburns easily and his eyes gets very sensitive to light. Lab study shows his deficiency in tyrosinase enzyme, and a diagnosis is established and found to have autosomal recessive mode of inheritance. The cells involved in his condition arises from which of the following germ layers? So based on this clinical information, we must be able to identify that this person is deficient in tyrosinase enzyme, indicates he is suffering from the condition known as albinism. So the cells for albinism is that he is deficient in melanin, and melanin are produced from melanocytes cells. So from our mnemonics in motile pass, the first M is melanocyte cells. That's why this person is deficient in melanocyte cells. And we know that the melanocytes are the cells of neural crest cells. That's why our answer would be option C, neuroectoderm, that is neural crest cells. So let's understand briefly regarding the tyrosinase activity. So at first, the phenylalanine under the action of phenylalanine hydroxylase converts into tyrosin. Tyrosin, when hydroxylated, converts into dopa, and dopa, if acted upon by tyrosinase, gets converted into melanin. So the person is having is deficiency in tyrosinase enzyme. So when there is a poor activity of tyrosinase, then of course he cannot produce enough amount of melanin and he suffers from the condition known as albinism. That's why he's getting very sensitive to light. And the cells of origin are the neural crest cells. One more question. So here a 22 years old man comes to office due to occasional dull headaches that awakens him from sleep. The patient has no associated neurological deficit and there is no history of migraines in his family. His vitals are, this one is open, uh, 37 degrees Celsius, blood pressure 140 by 80 mmHg, pulse 60 per minute, and respiration rate is 12 per minute. On physical examination, several 3 to 5 centimeter flat pigmented spots on his trunk are noted. There are also multiple sub-centimeter soft fleshy cutaneous tumors located on his trunk and neck. Our question is, the predominant cells forming these skin tumors most likely originated from which of the following structures? So, this patient has the clinical features of neurofibromatosis type 1, which is also known as von Recklinghausen disease, which is an autosomal dominant neurocutaneous disorder. This one is NF1, is a neurocutaneous disorder and is caused by the mutation in NF1 tumor suppressor gene, that is neurofibrin, which is a negative RAS regulator. And we know that this is on chromosome number 17. The patient usually develop a typical sign, that is hyperpigmented macules, which is also known as cafe or light spots over the trunk soon after birth, but they are at increased risk of developing central nervous system neoplasm like optic glioma, optic glioma, astrocytoma, and because of which it increases this glioma, they increases intracranial pressure and the patient generally present with occasional dull headaches. And these cutaneous neurofibroma, they are usually manifested during the early adolescence. So we can see here the age of the patient. He is just 22 years old and is presenting with the cutaneous tumors. They are multiple and raised fleshy tumors and they often increase in size and number with age, and these tumors are benign nerve sheath neoplasm and they predominantly comprised of Schwann cells. So we need to understand the source of origin of the Schwann cells, and these Schwann cells are embryologically developed from neural crest cells. The S in our mnemonics was for Schwann cells, which myelinates peripheral nervous system. So our answer is neural crest cells. So in the figure we can see cafe or lout spots, the cutaneous neurofibroma, which are the multiple raised and fleshy tumor. These are the fleshy tumor on the back of the person, which usually increases in size as well as in number with the increase in age. And also we can see these nodules in his eye. So with this we conclude our topic. Thank you. Stay tuned.